myself Dr. Shari, representing Kaili Ayurvedic Group, wherein I am practicing in their Delhi center. So first of all, let me respected official dignitaries, chair and co-chair, and Dr. Jose also. So moving forward, my topic of is Panchkarma. How about the Panchkarma role in every disease? So for that, I have picked up one of the topic which is clinically seen, because a lot of patients come up with this problem and they do ask for the treatment, how do we treat regarding that, and one I have picked up is hypothyroidism, where I could treat efficiently with the help of Panchkarma. So when it comes to treatment, everybody knows in Ayurveda we have two perspectives, that is Shamana and Shodhana. And Shodhana plays an important role when somebody asks whether we can cure it in a root basis. Should I keep continuing taking the medications? So our answer should be yes, and of course I could do that. So moving forward, I will brief thyroid. We know it's a butterfly shaped gland, where it present in the neck region, and it has a functional unit of producing T3 and T4, which is basically has to do with the metabolism. Now when it comes to metabolism, metabolism related issues are much related, like weight gain, it can be heart related issues, or it can be skin disease, it can be anything, because parathyroid change affects whole body physically and psychologically. Now thyroid gland, apart from this, the functional aspect, when there is a lack of T3 and T4 role, where T3 and T4 like secretion in the bloodstream, it affects. Here we implement the concept of Vata, Pitta, Kapha. So that is knowing the prakriti of a patient is very important, and then relating what doshas has been increased or decreased, that is disbalance, so that we can implement what is the proper Panchkarma that can be taken up further. So moving forward, so before that, as I told, I represent from Kairali group, because since they have a legacy of 34 years in the clinical practice, a well-profound established for this units across the world, and then production unit also. So the abstract what I brief for now is the thyroid thing. We'll move forward. So thyroid hormones, as I said, has an immense effect on the whole body, especially metabolism. So I'll just move with the case study. A patient came up with it was a male patient actually. So he is a known case of hypothyroidism since 12 years. He had come typically with the problem thyroid. He was asking whether Ayurveda can treat for thyroid, but he did have a symptom of rukshatva, that is dry skin. It's kind of psoriasis related to the thyroid, but the major reason for his skin disease was the thyroid. So we took it as a primary case and a secondary symptom of the skin disease. So when he came to the clinic, he had a TSH value 12.67. So that has been highlighted. And the personal history we have taken about his vital status, and took his prakriti, where he was very dominant with Vata and then Pitta. Of course, when it comes to thyroid, we have to consider the imbalance of Vata, Pitta, Kapha also, because thyroid is a gland, it is a function, that is Kapha. And Pitta immensely play a key role in the hormones. So when it came to this patient, I first preferred taking his prakriti and understood the dosha imbalance, and then other his symptoms along with that, where he had this TPO value also high and his HbA1c was high. Everything was related to metabolic disorders, because HbA1c is the sugar levels, of course it has to do with the metabolism. Now what I picked up based on the dosha, Pitta, these are all the Shroto, Dushtis and all. So straight away going to the treatment aspect. First Panchkarma I preferred taking was Nasya, because we had to apart from his skin disorder, we had to consider his thyroid. So Nasya I did prefer giving that, because it had to correct the pituitary secretions, because pituitary and thyroid is in a row. So that helps. Despite of his thyroid medication, still his TSH value was high. So I did a Nasya which gave an immense relief, like relief in the case that showed a basic nature when we took up before after values, lab values. Along with that, he had to respond for the skin disorders, where the Gritapanam, that is Virechanam, was supposed to, prior to that, because he had a Vata Lakshana, very dry in nature, I preferred giving him the Gritapanam for so many days. So unless he attained a proper Gritapanam Lakshanam internally and externally, then the Virechanam was done. And then the Vasti, and then Takradara externally for skin. With this all profound combination of Panchkarma and external therapy, and of course the diet also played an important role, so that the pituitary and the liver function in together. That is, thyroid also was taken care and the skin also was taken care. Then the results as per the last, along with the internal, once a Shodhana was done, Shamana Aushadhis was given, and then continued with certain procedures at home. And this was the last final results when he that bought within the 3 months. 6.25 was his TSH value. That too without, he had discontinued his thyroxine medicine also along with that. Now further carrying forward, he did ask, the patient did ask, how could we maintain, how can we maintain, because anything requires maintenance. This was the Panchkarma, this was the Shodhana and Karma done. Now further to carry with, we had given him Shamana Aushadha and the dietary restrictions, modifications in as per his body type, that is majority the Prakriti, and then his routine lifestyle, and then certain yogasanas, especially pranayama. Based on the concept of this, that is 5 kind of vata, 5 kind of pitta, 5 kind of kapha we do have. We took it, what was the major vata predominantly played in this thyroid and the major pitta. So in that aspect the medication has been picked up. So that has been written, like Nasyam had given Dashamula, then Gritavan with Mahatiktagam, Abhingam with this Eladi and Nalpamradi, then the Virachanam was done with Manibhadrapuda. So all this showed within a certain aspect time period what was the patient looking for a treatment was done. So within a 3 month of time he could withdraw his thyroid allopathic medications, where the allopathy didn't show him whether he can withdraw it. And we could do that, brought all the values down. It's not about bringing the values down the bloodstream, but then the symptoms which he faced due to the thyroid. That was a skin disease, majorly the skin disease, and that came down and fully cured. And right now he is just maintaining the lifestyle with few procedures, Pratimarshanasya daily basis, and the diet and exercise, of course few medications. So today I wanted to utilize a space for this, that what in clinical common, this is one of the common diseases which we see in a day-to-day practices, and that people do ask whether we can treat it. Of course we can treat it. We can treat it on the root basis if we could make out what is the Prakriti, what is the Doshi and Doshavastha, and how far we can implement before going to the Shamana. How does the Shodhana, the Panchkarma plays an important role, and Panchkarma does plays an important role. That is Nasyam, either it can be Vamanam, either it can be Virachanam, Basti. Of course all these plays a key important role, and I have picked up particularly this treatment protocol based on the patient history. So thank you.